A new study is linking tumors in rats to exposure to cell phone radiation, but the study is being challenged by some.
Here's CBS North Carolina anchor Russ Bowen with more.
Thanks, guys. Well, this morning in Health Watch, it's the one thing most of us always have by our side, a cell phone. No doubt, as mobile devices have evolved to do more and more, we've become more and more connected to them. But in recent years, there has been an increased concern about possible health risks from our cell phone habits. Scientists have been looking into this, and our medical expert, Dr. Campbell, is here with us this morning to talk about the findings of this new study. So first of all, what do we know about the health risks that come with cell phones?
The biggest thing we know right now is that we don't know. It's very controversial. There's been tons of study done, some of which suggest maybe there's some health risk. Others say that there's no risk at all. So I think the jury is really still out when it comes to the long-term effects of cell phones on our bodies.
Why is it still out? I mean, what is it that we're trying to figure out? And what's just rumor and, you know?
You know, some of the studies out there have looked at trying to associate increased risk of cancer or other things related to the radiation that's emitted from the cell phones. Cell phones emit very low frequency radiation in the form of heat. And right now, there have been no definitive studies linking cancers to cell phone use in humans.
Yeah, I think that that's part of the reason, too, that people have been using, you know, the earbud to talk and hold their phone or put it in their pocket, but really nothing right now to say that you can't hold it.
That's exactly right. There was a study done last week, and it was done in rats, and it was a big study that has been sensationalized in the media, so most everyone's probably heard about it, but what they showed was that in rats that were exposed to cell phone radiation for about 9 to 10 hours a day, there was about a 2% increase in tumors of the brain and heart. That doesn't happen in humans because we haven't seen that. And the thing we need to remember is you can't generalize these types of situations where you take cell phone findings in rats and bring it over to humans. Does that mean the same thing in humans? I would argue we don't know.
So what's the bottom line?
The bottom line is I don't think we have enough evidence to change our cell phone habits. I don't think we have enough evidence to change what we do. What it does tell me is that we need to study this in a very elegant, randomized trial so that we can really help understand. The thing we need to remember is we've been using cell phones for a very, very long time, and the rate of brain cancer has not increased in the United States over that period of time. So maybe it's not a big deal.
And you know, I guess at the end of the day, if you are really worried about it, there's that old house phone, and you can just wait till you get home and use it, right?
Yeah, what's that?
What
I don't know if I've seen a house phone in a long time.
My dad still uses it, trust me. All right, if you want to learn more about this study or have other questions, just go to our website. Dr. Campbell's right there at WNCN.com.